His name is Mikhail Varshovsky, but to his legion of social media followers, he's Dr. Mike. And many days he's unhappy with the politics of medicine in the United States. So let's get right into it. The big debate, vaccines yes, vaccines no. And I know you've done some Jubilee confrontations with skeptics where you've been surrounded by numbers of people pro and con. But how do you come down on it? There's so many people who say, I'm worried about the vaccines, and there are others that say, well, my doctor says I should get it, so I should.
Yeah, I think the reality here, Marcia, is we need to find some sort of middle ground in being able to have these difficult conversations. For too long, our policy was, we are right, you are wrong, we are experts, we do not want to even have this type of debate. But the debate is important. It allows us to hear people out, to hear their concerns, because vaccine hesitancy is real. People hear something on social media, they hear something on the news, they want to be able to discuss it freely with their doctors. I think we need to be there for them.
But here's the question. Are vaccines good? Are vaccines bad? Some good, some bad? What is it? Is it individualized because some people just can't tolerate it? What's the deal?
Yeah, obviously all of medicine needs to be individualized, and everything we're talking about right now is from a public health perspective, so it's very generalized. And when we're talking about vaccines as a general topic, vaccines are safe. And not only are they safe, they're tested much more thoroughly than even pharmaceuticals. Why?
But people don't trust the drug companies.
Right, okay.
I don't think.
Yeah.
Is that what you hear?
Yeah, absolutely. People are very skeptical of big pharma. Even the term big pharma carries a negative skepticism behind it. I think it's appropriate. Big pharma has had a lot of missteps. They've lacked transparency. Pricing is a disaster. But we need to address those issues and not paint with a broad brush and say they're all evil.
So here's the question. You're a doctor.
Yep.
People come to you.
Yep.
Are there some vaccines you say you should get them? And are there some vaccines where you say, nah, I don't think so?
Yeah, absolutely. Several vaccines are shared decision-making. Not all vaccines are considered mandatory, but there are many that we should be giving to patients that they're turning them down.
People should get them?
I mean, it's very dependent because it's based on age, based on exposures, what their comorbidities are, what other medical problems they have. So it's a conversation that needs to be had. And it's not happening because we have someone in charge of Secretary of Health and Human Services who paints vaccines with a negative broad brush. And to me, that's a failure of the system.
You've been very critical of Robert Kennedy Jr.
Yeah.
You think he should not be in office?
I absolutely don't think he should be in office. I think he does not lead with scientific integrity. I think he consistently makes inaccurate statements, whether it's talking about vaccines. Right now, Marcia, on his Twitter, he has a post that says the HPV vaccine causes more harm than good, which is so
true?
Flawed. Absolutely untrue, absolutely flawed. We've nearly eliminated cervical cancers in the United States because of HPV vaccines and preventive programs like Pap smears. And yet he's out here sowing distrust, saying inaccurate statements, and I'm not about gotchas. If he made a mistake and he wanted to correct himself, he can, but he does not. He repeatedly says inaccurate things. The Tylenol autism press conference is a prime example.
But see, so I want to pursue that because a lot of people don't want their kids to get vaccines because they're afraid they'll get autism.
Right.
Is that a myth or is that true?
It's not that it's a myth, it's inaccurate. We've actually studied this, and not just here in the United States, with dozens of studies across the globe, hundreds of thousands of children that have been tested, and we do not see a causative relationship between autism and vaccines.
Why do people believe that?
Because Secretary Kennedy proceeds to go out and say the same statements over and over again. And he's put a scapegoat on vaccines from the early 2000s and has changed that target since the early 2000s. Initially, he said mercury in vaccines was causing autism.
But do you think that that causes an increase in some of these diseases like measles and other childhood illnesses?
No, in fact, our measles outbreaks are happening in communities where there is less measles vaccination.
That's what I was asking.
Yeah, it's a huge problem because in order to get measles spread so quickly amongst a group of people that if you don't have over 90% of people vaccinated, you do not have herd immunity, and measles can spread like wildfire to those who aren't vaccinated because of their age or perhaps just not immunocompetent.
But are there questions that people have because of this whole vaccine debate that has made them afraid? So now you have issues of like individual liberty. I can choose not to. You have issues of I don't trust the drug companies and things like that. And so how do you overcome that?
By having a good primary care doctor, to have those conversations. First, personal liberty. No one's forcing you to get vaccines. If you don't want your child to be vaccinated, they can't participate in a public school program because they could put other children at risk. But you don't have to force your children to get vaccines. So personal liberty is still alive and well in this country.
But are you making them more vulnerable to childhood diseases?
By not getting the vaccine. Yes. Absolutely. You're putting your child at unnecessary risk. And I know this year we're going to have children get sick, get hospitalized, will die because they're not getting their vaccines.
So are there vaccines that you don't recommend your patients get? The reason I'm asking this question is my doctor has never met a vaccine he didn't think was great.
Okay.
But when it came to a COVID vaccine, he says, no, I don't think you should get that this year. Are there things in the repertoire of vaccines that you think, well, not everybody needs to get it?
Yeah, there's certain vaccines like the childhood immunization schedule that we follow one-to-one, but there's others like the flu shot, the COVID vaccine. Those are more shared decision-making vaccines that we could recommend generally, but if someone has different medical comorbidities, different exposures, we could say, perhaps for you as an individual, based on this discussion, we chose not to do them. But it doesn't mean that I don't recommend those vaccines, because I still do.
But here's the question. It's interesting what's happened to vaccines, because you used to be able to go to your doctor and your doctor would say, you need to get a flu shot, I'll give it to you, the nurse will give it to you.
Right. Now,
the drugstores have taken over saying you should get this vaccine, and if you have an account at any kind of drugstore, you get these, remember, did you get your flu shot this year?
Sure.
Did you get your whatever? Has that changed how people regard shots and getting immunized, because it's left the doctor's office and has entered just a regular drugstore?
I don't think that's contributed to any vaccine hesitancy. In fact, I think it made vaccines more available, and we need to think on this community health care front more often.
Is that because of the shortage of doctors?
Partially, but more so because we need to get more people immunized, and the more times we can reach them with that message and the availability, the more likely that they will get immunized.
So, but there are other issues that we have to talk about in terms of public health.
Yeah.
There's a lot of things, like I know you say that you don't think that Robert Kennedy Jr. should be there, but are there things that he's done that you could agree with? Like, for example, eliminating certain food dyes in cereals and other things like that?
I think Secretary Kennedy has gotten really good at getting PR wins for certain small policies that he's done, but actually has left the huge issues in healthcare worse off than since he started.
What's worse off?
We had trials ongoing for mRNA vaccines that could potentially stop pancreatic cancer, research into ALS, HIV, conditions that are actually harmful that he's slashing budgets for. The diabetes prevention program is ending. The EPA scientists by the hundreds were fired. He's an environmental lawyer that's supposed to be supporting environmental protections, and instead his administration is cutting them down. So I think this whole notion of making America healthy again, it's flawed from the outcome, from the outcomes.
What you're saying is that he's concentrating on small niche issues like, additives or food dye?
It's not even that they're niche issues. They're not proven issues. We've seen some initial patterns of food dyes creating two things happening at the same time: kids with worse attention spans and those who consume these foods that have food dyes.
Is that sugar?
It could be. That's why we need to be able to do research, further research, to establish whether this is a causative link or a correlative link. And we don't have money to do that because scientists are leaving this country every single day. We have a full brain dump of scientists, PhDs, leaving the United States.
Why
to me,
are they leaving?
Because Secretary Kennedy is cutting their budgets for research. They're losing their grants every single day.
And what effect is that going to have on the country if we do that?
This is going to create harm that's going to go well past this Kennedy administration. What's going to happen is that it's going to take 10 to 20 years to rebuild our scientific community, to be able to get down to the niche issues of why are we experiencing such chronic health disease issues in the United States? How do we address these? And the reality is, we need more research. We need more pharmaceutical input with controls in place, with regulations in place. But Secretary Kennedy doesn't think with a nuanced point of view. He says things that he believes from emotion rather than scientific principles.
We'll have to leave it right there for now. But up next, a civil liberties lawyer and the question of who is entitled to New York City press credentials. I hope it's me. We are back with Dr. Mike. I'd like to ask you about the shortage of primary care physicians. What's causing that, and why, all of a sudden are people having such a difficult time finding somebody to take care of them?
It's sad news for my specialty because I love primary care. I love being a family medicine physician. I truly think it's the best specialty because you're able to take care of an individual from birth to their death. And that is a special moment. You get continuity of care. Any change you make in their life, you get to actually see the improvements of that. And right now, with the amount of funding that we're having for residency spots, there's not enough of them. The residency spots that we do have are not being filled because people don't want to go into the lowest paying specialty. And in general, people are afraid of what's going to happen with healthcare. I talk to students.
Is it the insurance companies that aren't paying for things?
Insurance companies are making it very difficult to get reimbursements. The one thing that I will agree with Secretary Kennedy on is the cost of healthcare in the United States is astronomically high, and it's increased over the last 2 decades. But it's not because doctors are getting paid more. It's because of this huge administrative burden.
Why are things going up?
Here's what's happening. In order for me to practice medicine, it's not just me going into a room with a patient, doing an exam, having a conversation, making a diagnosis and a treatment plan. Now we need to have administrators on both ends of that equation. We need to make sure that the medications I'm prescribing are actually going to be filled, that they're covered. When I order imaging, some of the most basic imaging, ultrasounds, CAT scans, I have to get on the phone for half an hour and argue with this insurance company whether it's appropriate. I'm the doctor. I should be deciding whether or not this is appropriate care. But now with these administrators, there needs to be 10 people to take care of one patient.
But see, here's the question people ask. Many people pay a lot of money for health insurance. Yeah. And they feel that if they have health insurance, the health insurance should cover the MRIs and the X-rays and the things that you order.
Correct.
But they don't. You have to fight for it. Or you have to wait 3 days until it's approved.
Correct.
Why is that acceptable, and why don't we change that?
I think insurers have weaponized this point where they say there's a lot of fraud that can happen in a situation where doctors are making these orders, and they want to put in these safety processes to make sure that the care that's being given to patients is appropriate. But here's the issue. They can play with that margin so well that they can actually make it difficult for patients to get care, knowing that they will not argue, they will not appeal their decisions, that they will not go through the prior authorizations, therefore increasing their profits. And I think that has to change.
So it's all a profit motive.
It's a profit motive, absolutely, yeah. It's always about incentives, Marcia. Like, if we want to improve healthcare, we change the incentivization to make students want to go into primary care because they're going to be paid more than a cardiologist or an orthopedic surgeon. We're going to have a lot more students applying to primary care, and I think we need to start thinking about it in that way.
So basically what you're saying is that it's frustrating for somebody to go into primary care because of all the hurdles that they can't control.
Yeah, we went into primary care and healthcare in general because we want to help our patients. We want to spend time with them. And now the insurer is telling me I have to sit on the computer, typing away on the keyboard, not actually face-to-face with my patient. This is frustrating. Patients feel like we're gaslighting them, but it's not us. It's the system that's screwing us. And as a result, we hate our jobs. We start feeling like we're experiencing burnout because we want to help our patients. That's why more doctors are retiring than ever.
So what's the solution? I mean, is the solution to go to Washington and get somebody to advocate for changes in the system?
Yes, and I don't think that's a one-size-fits-all answer. What I'm trying to do with my YouTube channel, my podcast, is getting public support for this issue, getting more people to be aware of it, because the more people that are aware, the more that we can have influence in Washington, D.C.
So you have a podcast where you interview celebrities called Checkup.
Yep.
How do you pick them, and what's the one that was the most favorite?
Well, recently I had an interesting guest, Jesse Eisenberg of the Facebook movie fame, Social Network. He had a very amazing story that I want to share with you. He donated his kidney.
Really?
Living donor to a stranger. He went to NYU Langone, signed up for the program, got all his testing done, and donated his kidney. And I wanted to learn from him, why I invited him on the podcast, why he chose to do that. And he said for him, it just made sense. He loves being in service of others. He realizes and recognizes that kindness, gratitude is an antidote to his anxiety, to the nerves that he feels every single day. So he showed up, donated his kidney, and we're facing a huge organ shortage in this country. So the more we can get that message out there, the better.
That's an amazing story. So the other thing is you put yourself in discussion groups where it's called, I guess, Jubilee Surround, where you sit in the center, you talk to people one at a time, but it's a whole group of people who have maybe, they agree with you, they disagree with you.
They all disagree with me.
So what is that like for you to be the focal point of, say, 20 people who all want to take you on?
I get excited by that because I think discourse makes your messaging sharper. When I go onto those programs, even though we disagree, I learn a lot from those individuals. We have this notion in healthcare over the last 20 years where we believe we're experts, and it's a very paternalistic notion. I don't like that. We should be making decisions alongside our patients, not for our patients. So when I go into these debates and I approach it with validation, with empathy, explaining on a transparent level where my facts and knowledge is coming from, suddenly we start seeing eye to eye a little bit more. And it's not perfect. I try to do better with each episode, but I think we need to do that more in general.
So let me ask you, not to change the subject, but the World Cup is coming up, and a lot of people in New York, being germaphobes, are worried about the fact that we're going to get a huge influx of people from other countries, and they're worried if they're going to bring diseases that may come from abroad to New York, and what precautions they should take if they're at the games with them.
Yeah.
Your reaction?
I think if you're an immunocompetent, healthy, otherwise healthy person, doing the basics, washing your hands, staying well hydrated, making sure you're getting your 7 to 9 hours of sleep per night.
Should you wear a mask when you go to the World Cup?
I think that would be excessive, especially given the fact that it's an outdoor experience. What I will say is I do share in the concern that with increased tourism to New York, that we're raising the risk of an outbreak. And why I'm worried about that risk?
An outbreak of what?
Some sort of transmissible virus. We recently had in the news hantavirus, not that that's at risk right now, but it was in the news.
What about Ebola?
Ebola is being screened for by the CDC at airports. And right now, we are the least prepared we've ever been for any kind of epidemic, pandemic, because of Secretary Kennedy, because we pulled out of the WHO. We've closed offices down for preparedness, pandemic preparedness. We actually fired the scientists that were responsible for cruise ship safety. And we just had this cruise ship hantavirus outbreak. So we're less prepared than ever before. With more tourism, that's not a good equation.
So again, should we be developing more vaccines? Should we be developing more drugs? What's the answer?
We should always be in development.
So we need more research.
We need more research, and that's precisely the billions that have been cut by Secretary Kennedy, by Doge, by President Trump, and I wish that those things were changed. I think we need to start thinking less about fruity vape flavors getting approved and more about mRNA vaccines that prevent pancreatic cancer.
You know, though I was just reading something right before I came on about how, believe it or not, pizza and bagel stores in New York are now over the edge, struggling because the government is about to, and again, New York is about to outlaw bromated flour because they say that it's a carcinogen.
I haven't heard that specifically.
Do you think that's a government overreach, or do you think that the government should be doing something?
I don't know about that specific ingredient or that issue, but I will say that I know that the food industry is incredibly scared right now because these GLP-1 medications that are coming onto the market, these new ones, are so effective in limiting how much people are overeating. Therefore, snacking is becoming more rare. Overeating of foods like pizzas, bagels, burgers is becoming more rare.
But are these drugs really good for you? There's so many side effects.
Yeah, so when we think about a medication, all medications, all interventions have side effects. In fact, when someone says something is all safe, that's the shortcut to knowing that they don't do anything. Because if something has an effect, it always has an opposite effect. So these medications absolutely have side effects. They need to be used respectfully with a doctor's supervision, with resistance training, with dietary monitoring, all those things. But Marcia, we're facing a United States that is more overweight or obese than it is not. And that is a way bigger risk in many cases than the side effects of these medications.
But yet, some people are having, gastric issues and other things because of it.
Well, let me ask you a hypothetical question. What do you think is more problematic? That heart disease is the #1 killer in the United States, or some people have occasionally gastric issues?
Heart disease.
That's how we think about it in healthcare, but obviously on an individual level.
But people, when they it's funny because you watch these TV commercials or on social media platforms or wherever, and there's always like the greatest drug in the world for fill in the blank. Sure. And then there's like this disclaimer. But if you suffer from all of these things, or it could cause bleeding, it could cause this. So is it driving people? The need to put all that, I know, is important, but is it driving people away from taking drugs that could help them?
I think what's pushing people away from medications is this natural fallacy that they believe that something is natural, therefore it must be safe, it must be better, and that's not always the case. arsenic, cyanide, these are natural substances that are absolutely toxic. So we need to be more comfortable with nuance, be a little bit more open-minded, have these conversations with your primary care doctor to find out what's right for you.
So you have 30 million followers on social media. How did this come about? I mean, you went to medical school and all of a sudden you became a social media star?
Yeah, you know what's funny, Marcia? When I went to medical school, I was the youngest doctor in my class. In fact, I was not welcome, the sole student, not welcome to his opening party because I wasn't 21 yet. I was that young. And when I graduated, I started practicing in my family medicine residency at Overlook Medical Center in Summit, New Jersey. And an article went viral. And when my friends told me about it, I thought it went viral because I was a young doctor, because I published some research, but it was a very superficial title. They called me the sexy doctor. People magazine named me sexiest doctor alive. It became this whole superficial thing.
Has that affected you? I mean, did you get dates because of it?
I mean, at some point I definitely did. But now what I realized is it was an opportunity. It was an opportunity to get on television, to get in front of eyeballs, and tell a story that's meaningful with a little bit of a celebrity angle. And that's what I do on my YouTube channel. I try and take formats that are fun, transparent, basically going to where the people are.
Do people write into you and say, listen, could you do a show about fill in the blank?
All the time. That's every day. We take consumer recommendations, viewer recommendations all day long.
So I was reading your bio and I was interested in the fact that you wrestle.
I box. I'm a professional boxer, yeah.
You box, yeah, and you want to tell me about that?
Yeah.
Do you still do it?
Yeah, I still do it.
Aren't you afraid of like hurting your hands?
Well, I'm more concerned about my brain because of CTE, but I don't recommend most people to become professional fighters. Boxing, I think, can be a great hobby, hitting the bag, it's good for fitness.
But you actually do it professionally.
I do it professionally. I have an emotional tie to boxing.
Why?
When I was in medical school, I lost my mom to cancer. It was a tough journey. I think it made me a more empathetic doctor. But in that moment, it was a dark time for me and my dad.
So you got angry and started boxing?
I wish it was that dramatic. That would be a good movie script. But for me, it was more so that I wasn't taking care of my health. And I found a Groupon for a boxing class. And I said, you know what, let me put myself outside of my comfort zone, do this training. And I fell in love with the sport. It got me out of this dark time. So I box in respect for boxing.
Yeah, but you do it professionally.
Yeah. We raise money for charity. My last boxing match, we raised $125,000 for the Harlem Boys and Girls Club right over here in the city.
So do you have another project coming up?
Right now, I'm doing race car driving.
What?
Yeah, so we're trying to live on the edge and get people excited about healthcare, and if we can do it by doing one of these stunts, yeah.
You're going to raise money that? I mean, do you know how to drive?
Yeah, I know how to drive now. And
do you have a license?
I definitely have a license, but we also do this in unique ways.
What kind of cars do you drive?
Ferraris. I'm a Ferrari driver.
Excuse me.
Yeah. So, and recently we just set a Guinness World Record with the American Heart Association at the NFL draft on the field. We set the Guinness World Record for most people learning hands-only CPR in 1 hour. Seriously. It was a great moment. This was just a few weeks ago.
So you're using all of these things to send a message to people about their health.
Exactly. Celebrity culture is everywhere. People are obsessed with it. So if they're going to be obsessed with it, they like race car driving, they like boxing, let me be there as a doctor to educate them in the process.
You got another sport coming up that you're going to
No. I need a break. I need a nap after this version. It's tough.
What about your dog? I
have two beautiful dogs, Newfoundlands. They're the sweetest, kindest souls, and they really helped me.
They helped you get on social media.
Actually, it's my late dog that got me on social media. She's a Siberian Husky. We got her actually just a few weeks after my mom passed away to have something to bond over during a dark time.
And it was that picture that took off.
And that was one of the pictures. You're right, that took off.
So. Well, we're running out of time. I would like to have you come on again soon.
Absolutely,
You're amazing.
Marcia.
Thank you so much.
Thank you so much.
Thank you at home for joining us as well.